Formulas that treat dryness. Ching Suzan, apricot kernel and perilla leaf powder. All ingredients: Tzi Suye, 6 to 9 grams. Qian Hu, 6 to 9 grams. Qing Ren, 6 to 9 grams. Jiageng, 6 grams. Jike, 6 grams. Chen Pi, 6 grams. Fu Ling, 6 to 9 grams. Jibansha, 6 to 9 grams. Shengjian, 2 to 3 pieces. Datsao, 2 to 3 pieces. Gansao, 3 grams. Grind into a powder and take as a draft. Usually it is prepared as a decoction nowadays. Actions: gently disperses cool dryness, disseminates the lung qi, and transforms thin mucus. Indications are slight headache, chills without sweating, cough with watery sputum, stuffy nose, dry throat, dry white tongue coating, wiry pulse. This is for externally contracted cool dryness that interferes with the dispersing action of the lung, dispersing and descending action of the lung. This formula can be used for the following Western medical illnesses: chronic bronchitis, acute bronchitis, upper respiratory tract infections, emphysema. And some modifications are for the absence of sweating and a very wiry or tight pulse, add Qiang Hu. For diarrhea and a sensation of fullness in the abdomen, add Kang Zhu and Hopu. For a headache in the supraorbital ridge, add Bai Ji. For more fever, add Huang Qin. Mai Mendong Tang, Ophiopogonis decoction. All ingredients: Mai Mendong, 15 to 64 grams. Renshen, 9 grams. Jingmi, 6 to 15 grams. Datsao, 12 pieces. Gansao, 6 grams. Jibansha, 6 to 9 grams. Benefits the stomach, generates fluids, and directs the rebellious qi downwards. The indications are coughing, wheezing, shortness of breath, coughing up of phlegm that is difficult to expectorate, spitting of saliva, dry and uncomfortable sensation in the throat, dry mouth, 5 centers heat. Tongue is red with scanty coating, pulse is rapid and deficient. This formula treats lung atrophy due to heat. The symptoms are usually caused by heat from deficiency in the stomach. Some cautions and contraindications for this formula are: caution in cases with high fever and irritability where the pathogenic influence is still in the exterior and the qi and yin is not affected. It is also contraindicated in cases of dampness or lung atrophy due to cold from deficiency. Some Western medical indications for this formula are laryngitis, pertussis, pneumonia, chronic bronchitis, acute bronchitis, hypertension, diabetes, peptic ulcer, reactive lymphoid hyperplasia, asthma. Can also be used for the side effects of radiation therapy. Some modifications are for severe depletion of the fluids, add Sha Shen and Yu Zhu. For tidal fever, add Yin Chai Hu and Digu Pi. For a severe cough, add Chuan Bei Mu and Gualo Ren. For side effects of radiation therapy, add Zhu Hua, Tian Hua Fen, Sha Shen, Shan Yao, and Mudan Pi. Bai He Gujin Tang, lily bulb decoction to preserve the metal. All ingredients: Bai he 4½ grams, Sheng Di Huang 9 grams, Shu Di Huang 9 grams, Mai Mendong 4.5 grams, Xuan Shen 2.4 grams, Bei Mu 4.5 grams, Jiageng 2.4 grams, Dang Gui 9 grams, Bai Shao 3 grams, Gan Sao 3 grams. Nourishes the yin, moistens the lungs, and transforms phlegm and stops coughing. Indications are coughing with blood-streaked sputum, wheezing, dry throat and a sore throat, hot palms and hot soles, night sweats. The tongue is red with scanty coating, pulse is thin and rapid. Internal dryness of the lung due to lung and kidney yin deficiency with a heat from deficiency. This formula can be used for the following Western medical illnesses: chronic bronchitis, bronchiectasis, chronic pharyngitis, spontaneous pneumothorax, cor pulmonale, silicosis, and pulmonary tuberculosis. Some modifications are: for more copious sputum, add gualoran and sangbai pi. For coughing up profuse blood, remove jiageng and add baimaugen and xian he sao. For more fever and dark yellow sputum, add jimu and yu xing sao. For lung cancer with yin deficiency, add yu qing sao and qi sao and bai hua she and ban ji lian.